Hello. Effective communication is important in everything that we do, whether that is talking to a person about their needs or talking to family members about the care their loved one is receiving. It is also very important that we're able to communicate effectively when we are worried about someone and want to raise our concerns. You may feel that someone you care for isn't their normal self and may be becoming unwell. It can be difficult to communicate when we're under pressure or tired. It can be challenging communicating with so many different groups of people, including GPs, the ambulance service, and community teams. To assist you in getting your message across every time, there are tools available. These are easy to use and help information to be transferred accurately and safely between people. The best known tool in the NHS is the SBARD, Structured Communication Tool. SBARD stands for Situation, Background, Assessment, Recommendation and Decision. Evidence shows that using SBARD helps with communication confidence and patient safety. Start by explaining the current situation. Introduce yourself and state your role. Explain where you are calling from and what your direct phone number is in case you get cut off. Provide key information about the individual, including their full name, date of birth and NHS number. Explain what it is that you're concerned about and, if available, use the National Early Warning Score to tell them what the resident's current news is and what would be normal for them. Briefly state the person's relevant medical history. This should include medical conditions, any treatments or medicines that they're on, and whether they have a treatment escalation plan or resuscitation decision. This is where you suggest what you think might be going on and what you think is happening. If you aren't sure what is going on, don't let this put you off raising your concerns. Now think about what you want to happen next. Do you want the person to be seen? If yes, how quickly do you think they need to be seen? You can ask what you should do before help arrives. Finally, summarise your agreed management plan so that you're both clear on what each of you will do to care for the unwell individual. Importantly, remember to document this conversation in the care plan. Practice using SBARD every time you're handing over information to a colleague or healthcare professional, and soon it will become more familiar to you. It may even be helpful to have the SBARD template available next to the phone or in the care plan so that you can use it as a prompt when you need to. Remember, using a tool like SBARD will help you to get your message across clearly and safely.